Hey guys, it's Dr. Dawn, Chicago Zone Board Certified OBGYN. I'm here talking to you today about the abnormal pap smear. So I'm just going to jump on in. I know that you all know my mission. My mission is to optimize your physical and mental health. Hey Dr. Donna, thanks for joining. And I believe that optimizing your physical and mental health will optimize your spiritual health as well. So we're going to get started with this pap smear because it's something that we women get all the time, and I just want to make sure we know A, why we're getting it, and B, what we need to do if your doctor calls you or sends you a letter and lets you know if your pap smear was abnormal. So first thing I want to do is to kind of go over why we're doing the pap smear, what it entails, and what specific part of the body we're working with when we are getting the pap smear. So what I'm going to do is show you here in the body, and hopefully you guys can see it. I'll bring it up close. This is your anatomy in the woman. Basically every woman, as long as everything is intact, has this. So you see we have the uterus, you have your fallopian tubes, you have your ovaries. Your uterus ends with your cervix, and it's connected to your vagina. So the cervix, you can look at it and see. Hey, Dr. Shanika. Hey, Carl. Thanks for joining. You can see that the cervix is basically the opening to the uterus. The uterus, if you look at my picture here, is basically where the baby lives and grows and develops when you are pregnant. So every woman, as long as everything is intact, has this right here. And this is the uterus here, and right at the beginning part of it is the cervix. And if you guys have been pregnant before, you all are intimate with the cervix because when we're delivering you, we do the cervical exams, and we're checking to see if you're dilated and all that good stuff. So we do what's called pap smear. Papa Nicolau is what PAP stands for, and it is a screening test, and it screens for cervical cancer. The great thing about the pap smear is since its usage, we've been able to decrease cervical cancer by at least 50%, 40 to 50%, because we've done such a good job at stressing with women that this is important to do, and women typically are pretty adamant about coming in and getting that pap smear done. So let's review again. If you need a pap smear done, you don't have to go to a GYN doctor. You can go to a midwife. You can go to a nurse practitioner. Hey, Dr. Michelle. Hey, Tony. You can go to your internal medicine doctor. You can go to your family physician. So it doesn't mean that you have to see someone like me who's an OBGYN. You can get it done anywhere. And the benefit of that is that we are able to take care of lots and lots and lots of women with this screening test. So the key word is that it's a screening test. Screening means that it doesn't mean if it's abnormal that you have cancer. It just means that you're screening positive and that we need to look further. Okay? So let's go into what happens when you have a pap smear. Hey, Dr. Michelle. Typically, we do the pap smear during your pelvic exam. And that's important to note, too. A lot of times I'll ask ladies, hey, did you get your pap from this year? And they're like, yeah, I got my pelvic exam, so I'm sure I got a pap. And those two are not necessarily the same. So as your GYN doctor or your doctor that's taking care of women, if there's a reason for us to do a pelvic exam, we'll do a pelvic exam. And typically that is just a digital exam. We'll use our hands, and we go in, and we're palpating through your abdomen what your uterus feels like. And again, as long as your uterus is normal in size, we will palpate it and it'll be very small. So again, we are palpating for the uterus. And I'll show this other picture because this is basically how you look on the inside. Typically, we are going in with our fingers and we're pressing and we're making sure that your uterus is enlarged. We don't feel any ovaries that are enlarged or the ovaries aren't tender, and we can feel your cervix at that time. That's the pelvic exam. What we do with a pap smear is we use a spatula or brush or both And we'll go in, hey Yolanda, we'll go in using a speculum. A speculum is just something we put in the vagina. I'm using pictures so we know what's going on. We put it in the vagina, and the speculum is used to open up your vagina so we can look straight at the top of the vagina and see your cervix. And what we do is we take samples of those cells and with our brush and with our spatula. So the spatula gets these cells that are on the outside or facing us in the cervix. The brush goes right into the inner eyes of the cervix, and we get cells that are on the inside of the cervix, because we want to make sure that if there's some abnormal cells, we can capture them, okay? So, hey, sorry, Yolanda, thanks for joining me. So, we put the speculum in, we do our pap smear using the spatula and the brush, and then typically we'll have a little vial that has fluid in it that helps us to kind of spin that stuff down, look at those cells with the pathologist under the microscope. And what they're doing is making sure that those cells are normal squamous cells. So your cervix is made out of squamous epithelium. And so they're looking to see, okay, are those cells normal looking? So you'll go in, that'll happen, a week or two later, you'll get back your results. More times than not, you get a result that says, hey, your pap's normal, which means specifically that we have not seen any cells that look pre-malignant or malignant, all right? Malignant meaning cancer cells that are able to travel to different parts of the body. So, let's say you get a call back from your doctor and they say, hey, we got something abnormal. You have an abnormal pap smear, so we need to do further testing. Now, what we also need to discuss when we're talking about the pap smear is another way that we're able to look at the health of your cervix. And that is through testing for the HPV virus. That's the human papilloma virus, HPV. That virus has been noted, and it has different types that it comes in. So you have HPV1, HPV2, HPV16, 18, 24. Each specific virus has a number that goes with it, that tells us what category it falls in. Hey Matthew, thanks for joining. So, what you may also have, depending on your age group, is HPV testing. Now, we have found through research that we have low-risk HPV and high-risk HPV. The high-risk HPV is the HPV that when it is active, when you have an active infection, it can cause you to have an abnormal pap smear. And that can possibly lead to precancerous or cancerous cell. Hey, cousin Demetria. Hey, Shaquila. Thanks for joining. So, we will, depending on your age, and typically, if you are after age 30, they will do a pap smear and HPV testing. And let's say you do a pap smear and it's abnormal, then they will also look at the HPV typing and see what that is. So when they test for HPV, if it's negative, great. So what would be the normal routine, if you're 30 and above, is if you have a pap smear that's normal and you have HPV testing that's actually also normal or negative, meaning that you don't have an HPV viral infection present, or they don't pick up the virus in general. So let's say it comes back, your doctor calls you back in, and they can tell you a couple of things. One, that the pap smear itself is abnormal, meaning that the cells look abnormal, or that the HPV viral testing was positive, meaning that they found the virus. Now, it's a virus, kind of like the flu virus or upper respiratory virus is a virus, which means that it will set up an infection, it'll run its course, and your body naturally will fight that viral infection off. So depending on when we do the viral testing for HPV, you may be actively with an infection, or you may have had an infection recently, but it has already been cleared away. So if we really have to get more information, if we see that you have an HPV positive test, that's where the typing comes in play. So we, like I said, we have low risk and we have high risk. So let's say you had an abnormal pap or you had an HPV testing that was positive, they will automatically test to see if that HPV virus fell in the high risk category. And we don't even worry about the low risk, and we don't even test for low risk HPV, honestly. We only test for high risk HPV because we know that in conjunction with a abnormal pap smear, meaning that those cells that you took look abnormal, we know that you have a higher risk of maintaining or continuing to have these abnormal cells. And we know that if these cells are not taken care of, some type of treatment, or at least close observation, they can progress to cervical cancer. Now, the other thing about cervical cancer is it's a slow-growing cancer if it's actually in place. That's why the pap smears work so well. If you have abnormal cells, if you have low-grade intraepithelial lesions versus high-grade intraepithelial lesions, and that's just how we categorize the cells that we see if they're abnormal, you will still have a fair amount of time before it actually looks like frank cancer. I've been in practice almost 15 years. I've seen in practice one case of frank cancer from a woman that was coming in to see me. And that young lady hadn't had a pap smear in about 7 to 8 years. And I remember her distinctly because she said, "Oh, I haven't had a pap smear since she was born," and her daughter was in the room with her, and she was 7 years old. This lady came in, and unfortunately, she had frank cancer when I did the exam. So that's a real-life reason that I am really adamant about women getting their pap smears. But back to HPV typing. Hey, Tupwet, thank you for joining me. Back to why we need to do these pap smears. The pap smears, in conjunction with the HPV, will tell us, hey, we have abnormal cells, or hey, this young lady has HPV virus and it's high risk. So then what's the next step? What do we need to do next? And this is where women get really nervous, like, what's the next step? Do I have cancer, or what do I do? So the next step that we do, it depends again on what your results are. And let's say you had an abnormal pap smear and you were positive for high-risk HPV. What we would do next is called a colposcopy. And the colposcopy, again, can be done in the room. And that's where, if you have a doctor that's like a nurse practitioner, internal medicine, family practice, most of the times they will refer them to general OBGYN because we do that fairly frequently. But I do know that some midwives and some family practice people, they actually do it too because you just get trained on it. So you get referred and you get what's called a colposcopy. What the colposcopy really is basically a microscope that we use to look at your cervix in real time. So we'll set you up. It'll put that speculum in so we can see right to that cervix. What I'll do is I'll put on a solution that causes any cells that are abnormal to brighten, and they turn really white. And the other things we may see is you'll see that blood vessels that are present will rise to the surface of the cervix. So when I'm doing the colposcopy, I'll put that fluid on, I'll look and let it sit for a couple of minutes, and then I'm going to look with the microscope, which is the colposcopy, and see if there are any abnormal lesions that I see. When I say lesions, it's basically white spots or blood vessels or things like that. And so if I do see something that's abnormal, even if it looks a little abnormal, I'll do a biopsy. So there's this little utensil that goes through the speculum. It just has a finger or a prong that goes in. We take a chunk of tissue, and we are sending that tissue because we, again, want that to be sent to the pathologist so they can put certain dyes on it and look at it under the microscope to see, okay, is this pre-malignant or is it cancer? It can be a little uncomfortable, so I tell my ladies, just know that you may get a little pinch that you'll notice. But typically we'll take 1 to 2 biopsies. I've maybe taken 3 or 4 on a case that looks really abnormal, but typically 1 or 2. And then we'll do what's called endocervical curetting. It's the ECC, and it's basically your cervix looks like a little donut, and we'll just go right on the inside and scrape so we can get some more of those cells. Because if the cancer or if the precancerous cells are more internal of the cervix, we want to get documentation. We want to get those cells. So that's pretty much it. If both of those are abnormal, you'll get a colposcopy. Let's say you just had a normal Pap, but you had an HPV testing that was high risk only. We'll let you come back in a year and just do that testing again. We'll do the Pap and the HPV testing again. One of the questions that I get, especially from my moms, from my older teens, is, okay, when is the best time to get a Pap? When should I bring my daughter in to see a GYN doctor, and when does she need her Pap smear? So recent recommendations let us know that she needs to come in by age 21 for a Pap smear specifically. She doesn't have to get a Pap smear before age 21. And the reasoning behind that, and when she gets the Pap smear, it should be just the Pap smear itself. She doesn't have to get the HPV viral testing. We do the HPV viral testing and the Pap smear at age 30. But if you're between 21 and 29, we only do the regular, just the Pap smear, which is just the spatula and the brush, because HPV is very common. It is spread through sexual intercourse. But when you're younger, your body does a better job at fighting it off. So even though we may test you, you could come back in 3 months or 6 months and we may not find it at all, or it will have subsided. So we don't test our younger girls because they have a higher incidence of that HPV virus being present, but we also have a higher incidence of the virus being cleared and not causing problems. When I say causing problems, meaning setting up abnormal cells that potentially can march to cancer. So I'm going to go through. If you all have any questions for me, please put them in the comments, because I'm just kind of telling you what I think you should know. But if you have a specific question that you want to talk about, let me know, and I'll get to that. So let's say you did a colposcopy and the biopsies were positive. Again, they will let us know if it's low risk or low grade versus high grade dysplasia. And so if it's low grade dysplasia, we'll probably watch you. We'll have you come back in to get more testing, more Paps and HPV testing, because a lot of times these abnormal Pap smears, they get better on their own. Let's say we did a biopsy and you had something that showed high grade dysplasia. So with high grade dysplasia, we'd have to do removal of those cells. And there are different modalities that people use. The most aggressive would be what we call a cone biopsy. And again, in my picture here, the cervix is not as demonstrated, but let's say your cervix is probably about a few centimeters long, about 2 to 3 centimeters long. And so what we do is, with a knife or with a device, we cut a cone shape from your cervix. And the idea is that that cone will encompass the abnormal cells that are there. And we go fairly deep because we want to make sure if this abnormality or this potentially malignant cancer is high up in the cervix, we want to get that. So we'll do what's called a cone biopsy, and we'll send that off to pathology. They will look at the cells that are abnormal and make sure there's a margin of normal cells around them, and that's how we treat you. So a cone biopsy of some sort. Some people will do cryotherapy where you kind of freeze those cells. Some people will do cautery where they burn those cells. But more than not, they will do a cone biopsy. A LEEP procedure is the same as a cone biopsy. It's just done with a specific utensil to take that tissue out. So let's say you've done this, you've done the colposcopy, for whatever reasons you needed to get a cone biopsy of some sort done. Then after that, we have follow-up. And usually it's yearly that we'll have you come in to see us to make sure those Pap smears are normal. Now that's another thing to talk about, how often you need to get your Pap smear. It used to be that we would have our ladies come in every year to get their Pap smear. And I actually like that because then I can kind of keep an eye on what's happening. Recommendations have changed because we can get so much information from the HPV and the Pap smear. So, if you're age 21 and between 21 and 29, you only need the Pap smear. If that Pap smear is normal, you actually only need to come in every 3 years. So, 21 to 29, you go in, you just get a Pap smear. That Pap smear is normal cells. Then you come back 3 years later. Let's say you're between age 30 to 65. In that age group, you're going to come in and we're going to do a Pap smear and we're going to do the HPV testing. And that testing should be high-risk testing only. If you come in and both the high-risk testing HPV is negative and the Pap smear is negative, you actually can stretch it out to 5 years. Now, I tell my ladies, depending on what else is going on with you, you may want to get in to see your GYN or your doctor more frequently than that. But if you are just coming in for your Pap smear and you don't have any other issues like endometriosis or fibroids or anything like that, you can come in every 5 years. But if you're someone who has had a high-grade dysplasia, you had a colon biopsy that they had to do, you're going to be coming in every year, at least for 3 years. And each time you come in, we want a completely normal result. Once you get to the point where you come in and everything is normal, you can go back to 3 to 5 years. But that is after you've had more frequent testing. So, I have my list. I always have a list of things I want to make sure I tell you guys. I'm going to go through my list again. I think I covered when you need to get a Pap smear. That's age 21. 21 to 29, Pap smear only. You don't have to do any other testing. Some doctors will do it, but you don't technically have to do it. 30 to 65, you'll get the testing with the Pap smear with the HPV viral testing, and they'll test you for high risk only. And if you're 21 to 29, every 3 years, as long as everything's good. And from 30 to 65, you'll come in every 5 years. Again, a lot of times ladies come in for other reasons, birth control, vaginitis, pelvic pain. So you probably will get in to see your OBGYN sooner than 5 years. But if you're lucky enough where you have that perfect health, then go for it. And that's really it, guys. So hopefully you got some good information about this. We talk about the Pap smear a lot, but we don't really go back and explain it all the time. So hopefully you'll have some good information. If this information was good for you, please share the video. Let your friends know about it. And if you're interested, that information that I got, the pictures, was actually from my own book. I have a book called The Clever Girl Life, Teen Guide to Positive Body Image, Self-Confidence, and Life Happiness. In it, I talk a lot about issues for women that, we got 20 minutes. I don't have the time to talk to you about all the things that I'd like to talk to you about. But this book is really a summary of what I think all my patients should know. And we start with basic anatomy. We go over the menstrual cycle. We go over vaginitis. We go over contraception. And we talk about how you become confident, how you have a positive body image, how you are confident in who you are as a young woman, and some of the things that you can do to build that confidence, and some of the things that you can do as you're a teenager with questions about sexual activity, things you can do, options that you can try in lieu of starting sexual activity. And then if you decide to be sexually active, things you can do to protect yourself and stay healthy and make sure that you are getting pregnant when you want to get pregnant, and not as a result of not thinking everything through. So this is available on my website. It is www.drdawn, OBGYN. That's www.drdawnobgyn.com. And it's not a huge book. It's not hard reading, but it has a lot of information. So don't let the thin book fool you. I put probably everything I think you should know that I've learned or dealt with in my 15 years. I put it in this book. Hey, Julie, thanks for joining me. So check this book out and spread the word, share these videos. And if you have a topic that you would like me to discuss, drop me a direct message me, let me know, or put something in the comments, because this topic I actually got from talking with a friend of mine who had questions about the pap smear. So if you have a topic that you wanted me to discuss, all topics are good topics, let me know, and we will discuss it next. So again, it's Dr. Dawn, Chicago's own board certified OBGYN. I am here because my goal is to keep women intelligent about their bodies, intelligent about what's going on in their bodies, because I think once you have that knowledge, that will help you to make better decisions about yourself and for yourself. So I'll sign off for now, spread the video, and I'll probably be back on probably in another, I'll be honest, probably in another 2 weeks. I like to say another week, but it's probably going to be 2 weeks because life happens. All right, see you guys.